We have been in the RCM space for over 15 years now, and we've done a number of research reports in these areas and have watched the evolution of the ecosystem evolve along with healthcare as it's been. Our next-gen RCM report wasn't meant for only providers. It was meant for the payer industry as well. They're the other side of the coin. They're the one on the other side of the transaction from the provider. And this isn't a provider-centric problem, nor is it a problem created by payers, but it's actually the interplay of those two constituencies where there's so much friction and waste.
The revenue cycle management process is incredibly complex. Every payer has their own set of rules and clinical guidelines and procedures that a provider needs to adhere to. There are enormous opportunities for technology vendors and services vendors to apply solutions that simplify this incredibly complex workflow.
As we think about changes in healthcare payments, there are 4 emerging strategies that we highlight in the report. First, organizations are becoming the healthcare payment network. Secondly, organizations are leveraging a payer-sponsored payment network. Thirdly, organizations are facilitating a unified 360-degree view. And finally, certain companies are capitalizing on patient pay opportunities.
I think it has the potential to hold a lot of linkages around the patient's experience with the health system. In other words, it's a focal point for a lot of opportunity and ongoing payments and things of that nature that draw them back to the facility that they once visited, and hopefully that's a good experience for them. And there's a lot of other things that come out of claims and payments data that have a lot of interplay with regard to the health system's financial success and their opportunity to do other things and reinvest that in other areas of clinical improvement and enhancement and ways that the care experience can be amplified even more.
Payer-sponsored payment networks are increasingly being leveraged because of the speed and efficiency through which those payments can be facilitated to the provider. That can be done because of the visibility that a payer has to all the various claims edits and modifications that have been made in advance of that payment. So when they go back to the provider, they can tell them exactly what's changed and why to reduce provider abrasion and support the payment that's been made.
Historically, parties that were on the other side of a patient experience, such as health systems or health plans, had no real incentive to communicate and cooperate with each other. In the changing healthcare environment, more and more providers are looking like payers and payers are looking like providers, but more than anything, the payers are forcing upon the health systems and other providers to participate in risk-bearing, value-based payment arrangements.
We're evolving from a fee-for-service environment where the role of the payer in a revenue cycle management context is ensuring accurate and timely payment to their provider network. As we now shift into more of a fee-for-value or value-based world, entirely new payment models are emerging where the role of the payer is really evolving in that new context.
The patients more than ever know that they're accountable for that. And health systems are trying to equip themselves with the right tools, the right support, the right advocacy, and doing so by exception, not on a every case basis, but allowing those folks that need the help to get it, and then automating as much as possible is really the key to success in an RCM context. I would like readers of the report to take away that there is a lot of progress that has been made, a lot of consolidation that has taken place, but there's a lot of room for improvement.